The birth control pill is one of the most popular and effective forms of contraception available today. The pill works by using a combination of hormones to prevent ovulation, which is the release of an egg from the ovaries. While the pill has been proven to be very effective for many women who wish to have more control over their reproductive health, it also comes with negative side effects. In this presentation, we will explore the mode of action of the birth control pill, its history and development, and its potential side effects. Additionally, we will also touch on emerging options for male and female birth control and their efficiency and availability.
History and development of the pill. The development of the pill actually began as an experiment with plants. So in the late 1930s, chemistry professor Russell E. Marker was doing experiments to try to synthesize progesterone, which is the hormone that's produced during pregnancy. And he discovered that progesterone could be synthesized by initiating this chemical reaction sequence on sarsaparilla, which is a steroid derived from the sarsaparilla plant. But this process was pretty expensive and time-consuming, and so he went through a lot of trouble to find a cheaper and faster way to do this. One of those ways was to try to find plants with a natural steroid that was closer to the chemical makeup of progesterone, which he ended up finding in a breed of giant yam that grows in Mexico. So he went down to Mexico, he opened a lab called Syntex, and they started producing progesterone as well as other steroids such as cortisone and testosterone. Unfortunately, he left Syntex on pretty bad terms in 1945, but his position was taken over by another chemist called Carl Djerassi. Djerassi is actually known now as the quote-unquote father of birth control, and he was the one who led his team to first create the synthetic version of progesterone, which is called progestin. And progestin was important because progesterone itself weakens and becomes less effective when it's taken orally, whereas progestin does not. And the progestin that they synthesized was called norethindrone. So although the initial research and development of norethindrone was led by men, it was, as you might expect, women who did all the heavy lifting when it came to getting this drug approved as an oral contraceptive. In 1916, Margaret Sanger opened the first birth control clinic in the United States and then founded the American Birth Control League in 1921, which would later become Planned Parenthood. And she was a nurse and a suffragette who was interested in finding an oral contraceptive solution, and because of that had been following the progesterone research very closely throughout the 1940s. Then, in 1950, her close friend and collaborator, Catherine Dexter McCormick, inherited a ton of money from her husband who died, and she donated a chunk of that to the research being done on oral contraceptives. She actually ended up donating what would be the equivalent of about $18 million today, and without her funding, the development and first clinical trials of the first oral contraceptive would not have been possible. So in 1957, the first version of the pill was approved by the FDA. It was initially approved for use as a menstrual regulator, but it was also widely used as a contraceptive because the quote-unquote side effects listed on the packaging warned that it would also prevent pregnancy, and people are smart, so that's what they used it for. It actually got approved as an actual contraceptive in 1960, but it was initially only available by prescription to married women. However, by 1967, it was being widely used by around 13 million people, and in 2018, the number of people using the pill was around 151 million.
There exist two types of oral contraceptives. combination oral contraceptives, and progesterone-only pills. Both are one-a-day pills that are taken orally. Combination oral contraceptives use synthetic versions of their respective counterparts, estrogen and progesterone. These two hormones work to impede the menstrual cycle and prevent ovulation from occurring. Ethinyl estradiol mainly works by suppressing the release of follicle-stimulating hormone from the pituitary gland. Progesterone works by suppressing gonadotropin-releasing hormone from the hypothalamus. To better understand the mechanism of action, we must take a look at the ovulation cycle. The ovulation cycle has 28 days duration. During your early to mid-follicular phases, the hypothalamus produces gonadotropin-releasing hormone, which travels down to the anterior pituitary gland and stimulates gonadotropins. In turn, this releases two chemicals into the bloodstream, follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH. These hormones travel down to the ovaries, and once inside, FSH becomes responsible for stimulating primary follicular cells to grow around an oocyte. LH acts on the thecal cells that surround the follicle and converts cholesterol to androgens. Then, these androgens move next door into the granulosa cells and form estrogen, which is stimulated by FSH. Upon entering the late follicular and luteal phases, the egg is now matured, and estrogen is released in high amounts from the ovaries, which causes a positive feedback. This creates a large influx of FSH and LH. The high amounts of LH causes the egg to protrude from the follicle inside ovaries and pushes the cycle into ovulation phase. Post-ovulation, the follicle from where the egg was released projects estrogen as well as high levels of progesterone, which are secreted due to the active luteinized granulosa cells. During this time, progesterone actively suppresses release of gonadotropin-releasing hormone, and estrogen potentiates this action by suppressing the release of follicle-stimulating hormone. The following graph is a depiction of the entire cycle. If you look around day 18 to 24, which is post-ovulation, you will notice how during high levels of progesterone and estrogen, your LH and FSH become suppressed. Essentially, combination oral contraceptives mimic this behavior, tricking your body into thinking that ovulation has already occurred. You can also see the changes in your endometrium along the uterus. The wall becomes the thickest during ovulation as to allow easy access for sperm and preparation for potential embryo plantation. Now, if your body does not become pregnant, the thickened lining of endometrium on uterine walls shed and menstrual bleeding begins. This resets the cycle and starts all over again. When taking combination oral contraceptives that contain 7 days of placebos, your progesterone and estrogen levels fall during this week. This can cause a withdrawal period or fake period to occur. There is also an option of continuous birth control pill in which withdrawal periods happen once every 3 months. The second type of oral contraceptives are progesterone-only pills. As the name stated, these pills have only progesterone. They are not quite as effective as combination oral contraceptives since there is no ethinyl estradiol, which potentiates the effect of progesterone. Ovulation can occur, although it is rare. Another main effect is that buildup of mucus inside the cervix, which acts like a barrier, so incoming sperm have a harder time getting across into the uterus. The potency of progesterone pills rely heavily on time sensitivity. This means that a person using this sort of birth control requires to take it at the same time every single day. Skipping a dose can decrease the effect drastically.
Moving on to the negative side effects that oral contraceptives have on women. First, we will look at the more common side effects that are generally associated with the pill. Many women experience changes in their menstrual cycle. More commonly, women will have much more sporadic bleeding or some spotting. And less commonly, some will experience periods of heavy bleeding, or even more rare, no bleeding at all. Headaches and nausea are also very typical, especially when first taking the pill. Some women also experience moodiness, fatigue, and a decrease in libido from the changes in hormones. It can also impact insulin resistance, which will cause an increase in glucose levels in the blood. This is especially important for individuals with diabetes to be careful with. Hormonal acne is another common side effect due to the androgen progestin, which is the man-made version of progesterone. Progestins also make vaginal fluids thicker to help make it more difficult for sperm to travel, which causes an increase in vaginal discharge. Some also experience breast tenderness because these hormones tend to increase the size of the breasts. Typically, these more common side effects go away after 3 to 5 months of taking the pills, but sometimes doctors may prescribe a different oral contraceptive that may work better for the individual. Some more serious adverse side effects are much less common. These side effects are usually due to other contributing factors such as age, health, and certain habits like smoking. Smoking is one of the worst things to do while taking oral contraceptives because it greatly increases the risk of blood clotting, which leads to a greater risk of stroke, venous thrombosis, and even myocardial infarction or a heart attack. The risk of blood clotting also greatly increases in women over the age of 35 who are taking oral contraceptives. There have also been cases of the pill being linked to breast, cervical, and liver cancer. The hormone changes have also been associated with causing severe depression in some due to their effects of the brain. Even though these are much rarer side effects, it is important to be seen by a medical professional regularly and avoid bad habits like smoking.
Hello class, my name is Luis Godinos, and today I will be talking about the benefits of birth control that can affect the quality of life of a person or perhaps even save their life. Before I start talking about the benefits of birth control pill, not everyone will react the same and may need to try other kinds of hormonal treatment for their needs. First off, the most important benefit to birth control pill is of course the prevention of pregnancy. Many people may not be ready for a new addition to their life, maybe health reasons or simply do not want kids. But at a whopping 93% efficacy rate, it is really hard to beat. The only other method that is 100% in preventing pregnancies is abstinence. Both combination and progestin-only pill lower risk of ectopic pregnancy, reduce menstrual cramps, and lighten periods. Birth control pills can prevent or lessen the effects of acne, endometrial and ovarian cancers, infections in ovaries, uterus, and fallopian tubes, premenstrual syndrome, anemia, cysts in breasts and ovaries, and polycystic ovary syndrome. Two of the most common use for birth control pills other than to prevent pregnancy is for acne and PCOS, which is polycystic ovary syndrome. As mentioned before, the combination pill has estrogen and progesterone. Our sex glands and adrenal gland produce androgen, which is a hormone responsible for producing sebum. When a woman is going through her menstrual cycle, androgen levels can rise, which results in acne breakouts. Birth control pills contain estrogen and progesterone that reduce androgen levels. Unfortunately, the mini pill can make acne appear more aggressively because it only contains progesterone. Polycystic ovary syndrome is an endocrine disorder that affects women when they are of reproductive age. Some of the disorders that afflict women is small fluid-filled cysts forming on the ovaries, high levels of androgen, irregular ovulation, and many other disorders which are shown in the picture to the right. Estrogen in the combination pill works against androgen by activating the hepatic synthesis of sex hormone-binding globulins that reduce testosterone. Additionally, progestogen, a synthetic form of progesterone present in both combination and progesterone-only pills, suppress luteinizing hormone secretion and reduce the activity of alpha reductase enzyme, which is responsible for converting testosterone into dihydrotestosterone, DHT for short, and this is what causes women to develop male features. The most important use for birth control is to prevent lifelong chronic health issues, which results from untreated PCOS, such as diabetes type 2, weight gain, trouble losing weight, and high blood pressure, which can eventually lead to cardiac arrest.
Okay, I'll be covering male birth control. Since the invention of the pill and its widespread acceptance since the 1960s onward, the primary concern of pregnancy prevention and family planning have fallen more squarely on women. The options for individuals who produce sperm to actively take part in contraceptive practices have largely fallen into two categories: use of condoms or other barrier methods, and having a vasectomy. Although I am sure we are all aware that condoms are beneficial in many ways in regards to sexual health and prevention of pregnancy, it is by no means a fail-proof strategy to prevent pregnancy. Vasectomy is also a viable option. Vasectomy is the cutting and tying or cauterizing of the vas deferens that comes from each testicle. It has a much lower failure rate, 0.01%, compared to condoms, which can fail 2% of the time when used perfectly every time, or 13% of the time for typical usage, not perfect every time. It is much more successful in preventing pregnancy, but also requires a sense of certainty from the person involved that they feel sure that they never want to have children with their own genetic material. This is the case because although it is possible in some cases to reverse vasectomy, it is not a guarantee. Since both of these options lay at either extreme of the spectrum of family planning, from casual sexual partners to deciding to definitively never have children, it only makes sense that people who produce sperm also have more diverse set of options to take part in family planning and contraceptive practices. Here are some options that are being researched. Firstly, it's sperm reduction through hormonal techniques, kind of the flip side of female birth control. Normal sperm counts for ejaculation are something in the range of 15 million sperm count per milliliter. If sperm production can be reduced to 1 million sperm per milliliter or less per ejaculation, scientists have concluded that that is sufficient to prevent pregnancy. And here are some options that begin to limit that production. So testosterone is a hormone that we're all familiar with. It's a hormonal signal that communicates from the testicles to the brain to facilitate sperm production. One type of birth control option is putting testosterone in the body to intercept the communication loop, and then the brain thinks there is sufficient sperm production already in place. Basically, the brain reads the testosterone levels as normal and does not induce further sperm production. Progestin is also another hormone, and it's a hormonal way of suppressing sperm production. It's usually taken in tandem with testosterone, and the pills that were developed for this technique cause the liver to overwork and filter too much, which leaves it vulnerable. So the current version being tested is a gel that is rubbed into the skin, and the hormones are absorbed that way through the dermis, not orally. There are also non-hormonal methods that are being investigated. Win 18466 was discovered in the 50s and looked very promising. It was a type of drug that disabled enzymes in the testes needed to produce sperm. Initially, I believe it was being researched to be anti-parasitic. In the trials in humans, which took place in a prison, unfortunately, it was one of the prisoners got really sick, and it turned out that the enzyme that is disabled is also key to liver functioning, and specifically liver processing of alcohol. And so if it's mixed with alcohol, the person very quickly, pretty much immediately, gets alcohol poisoning because their liver can't process any of it. The unfortunate effect of that is that researchers decided not to move forward because they thought it would be too hard to market something like that, and the cost would be too great to the population who did not follow directions of abstaining from alcohol while on this contraceptive. This one is pretty new. It's called soluble adenyl cyclase inhibitor, and this soluble adenyl cyclase is essential for sperm development of motility, the flagellum. And when this is inhibited, the sperm gamete does not fully develop flagellum and is not mobile enough to swim into the uterus before dying. The promising aspect of this drug is that it can be taken on demand and is effective within 15 minutes and becomes less effective after 3 hours and fully reversed after 24 hours. So the fact that it can be taken on demand is much more suitable to most lifestyles as opposed to some of the hormonal methods which can take up to 3 to 4 months for the sperm count to be fully reduced enough to be actually considered a contraceptive. Here's a slide of just kind of the gel being applied and how that kind of works in the greater loop of the body. There are some challenges to this research moving forward. The first one being that males don't have a physiological process in which sperm production stops. Once a male reaches puberty, they produce sperm for the rest of their lives. Whereas a female stops egg production during pregnancy, and initially this is what birth control was mimicking, was that natural process. The main other one is that for drug approval to move forward, it needs to have a good cost-benefit analysis, and since men don't carry the pregnancy, their risk in pregnancy is very low, and it has a bias in how that research moves forward.
The birth control pill has had a significant impact on reproductive health and the empowerment of women. Developed over decades, the pill is still one of the most effective forms of contraception available today. The pill uses a mode of action that prevents ovulation and therefore prevents pregnancy. The pill also comes with potential negative side effects that should be taken into consideration when deciding whether or not it is the right option for a person. Recently, there has been a growing interest in male birth control options. There are some options under development, but the available choices are limited. With ongoing research and development, it is hoped that a wide range of effective and safe birth control options will be available to people of all genders in the near future.